According to the American Academy of Pediatrics, newborns should sleep on their back and not on their stomach or side. However, after the age of 12 months or more, sleeping on the stomach turns out to have several benefits for babies too. What are the benefits of sleeping on his stomach for babies, and what are the dangers if the baby is invited to sleep on his stomach too soon? Come on, see the following explanation. Benefits of sleeping on the stomach for babies. Sleeping on the stomach is only recommended when the baby is 12 months old or older. Meanwhile, for premature babies, sleeping on the stomach must be adjusted again according to the correction age. The key to getting a baby to sleep on his stomach is actually when he can move his own body freely, either to return to a supine or prone position. Well, besides being a new development milestone for babies, sleeping on your stomach also has a number of benefits, mums. Here are some of them.
1. Babies feel more comfortable. When babies find a new position while sleeping, such as on their stomach, they are very likely to like it. For some babies, this position is more comfortable than sleeping on their back. 2. Longer sleep cycles. Joan Becker-Friedman, RN, certified pediatric sleep consultant in Milwaukee, Wisconsin's Peapod Sleep Consultants, says babies who naturally sleep on their stomach tend to sleep longer. Research has also shown that premature babies who can sleep on their stomachs have better sleep quality than if they sleep on their backs.
Dangers if babies are forced to sleep on their stomach before time.
As previously mentioned, proneness is recommended if the baby is 1 year old or when the baby is able to move freely to flip. However, if this position is applied to the baby prematurely, then there are several risks that may occur, including
1. SIDS, sudden infant death syndrome. Although sleeping on the stomach has not been shown to directly cause SIDS, leaving a baby who has not slept on his stomach on time in this position is very risky for his safety. However, sleeping on his stomach for short or no more than 30 minutes and under supervision can help your baby increase the strength of his neck, shoulders, and back.
2. Suffocation. Allowing a baby to sleep on his stomach and not yet have the ability to control his body is very dangerous and lethal suffocation. The reason is, when the baby rolls over and presses on the stomach, the airways will also be compressed. In the long term, this can cause the baby to have difficulty breathing and result in suffocation. Therefore, pediatricians strongly recommend that while sleeping the baby should be in a supine position or support the baby in a side position. 3. Inhaling carbon dioxide. When your baby sleeps on his stomach, he will enjoy the air trapped in the bed or around it. This can cause carbon dioxide levels and low oxygen in the baby's lungs. As a result, in some cases, the baby will have difficulty breathing and trigger SIDS.
4. Increased body temperature. This study shows that sleeping on the stomach can activate the ability to regulate temperature and release heat, especially in infants with low birth weight. As a result, the baby will feel hot and become a trigger for SIDS. 5. Upper airway obstruction. Many parents think that babies who sleep on their stomach are less likely to experience aspiration. Aspiration is a condition in which babies inadvertently wet into the lungs when they salivate. However, researchers have revealed the opposite. The supine position is actually ideal and prevents the baby from aspiration. At the right age, letting the baby sleep on his stomach does have many benefits. However, do not reach the limit when the baby's age is not yet or when the ability for his body is still limited. Because this is very risky for the safety of the baby.